Good day, everyone. I'd like to present to you a drug used to treat an upper respiratory tract infection. But first, let us have a short preview of the organ system assigned to my group. The upper respiratory tract includes the sinuses, nasal passages, pharynx, and larynx. These structures direct the air we breathe from the outside to the trachea and eventually to the lungs for respiration to take place. An upper respiratory tract infection is an infectious process of any of the components of the upper airway. Infection of the specific areas of the upper respiratory tract can be named specifically. Examples of these may include rhinitis, inflammation of the nasal cavity, sinus infection, sinusitis or rhinosinusitis, inflammation of the sinuses located around the nose, common cold, nasopharyngitis, inflammation of the nares, pharynx, hypopharynx, uvula, and tonsils. Pharyngitis, inflammation of the pharynx, uvula, and tonsils. Epiglottitis, inflammation of the upper portion of the larynx or the epiglottis. Laryngitis, inflammation of the larynx. Laryngotracheitis, inflammation of the larynx and the trachea. And tracheitis, inflammation of the trachea. For this video, the drug that I will be featuring is a drug used to treat allergic rhinitis. Most cases of upper respiratory infection are caused by viruses, and therefore require no specific treatment and are self-limited. People with upper respiratory infections typically diagnose themselves and treat their symptoms at home without requiring a doctor's visit or prescription medications. However, treatment of the symptoms of upper respiratory infection is usually continued until the infection has resolved. Some of the most common upper respiratory infection medications used to treat these symptoms are the following: antihistamines, which are helpful in decreasing nasal secretions and congestions; cough medications, antitussives, and expectorants, which can be used to reduce cough; steroids, orally and nasally, are sometimes used to reduce inflammation of the airway passage and decrease swelling and congestion. Broad-spectrum antibiotics are sometimes used to treat upper respiratory infections if a bacterial infection is suspected or diagnosed. Decongestants, which are used to reduce nasal congestion. Among all of these, I will be focusing on decongestants. The mechanism by which decongestants produce their action is activation of post-junctional alpha-adrenergic receptors found on precapillary and postcapillary blood vessels of the nasal mucosa. Activation of these receptors by either direct binding of the sympathomimetic agent to the binding site of the receptor or by the enhanced release of norepinephrine produces vasoconstriction. Such vasoconstriction decreases blood flow through the nasal mucosa and results in shrinkage of this tissue. Decongestants can be administered topically, directly onto the nasal mucosa, or orally. Sinomarin plus algae allergy relief with Algomer Complex is a novel 100% natural nasal spray that relieves symptoms associated with seasonal or chronic nasal allergies. It cleverly combines seawater, a hypertonic solution at 2.3% sodium chloride, with a unique blend of natural seaweed ingredients that guard the nasal tissues from contact or entry of harmful external agents, providing additional strength and protection to the nasal mucosa. Sinomarin plus algae allergy relief is classified as a nasal decongestant. Its nasal benefits include the following. It relieves allergic rhinitis symptoms, including blocked nose, sinus pressure, runny nose, and sneezing. It cleanses the nasal cavities, eliminating mucus and mucus-trapped allergens. It relieves local irritation and soothes the nose and helps promote natural recovery of the nasal tissues. Aside from these, it is 100% natural, free from drug substances, additives, and preservatives. It is antihistamine and steroid free, and it offers no habit formation or rebound effect. Sinomarin plus algae allergy relief works alone as a natural alternative to anti-allergic treatments or in combination with them to help improve the overall treatment efficacy. Its mechanism of action include direct mechanical cleansing of the mucosa from allergens and other particles, decrease of inflammatory and/or allergic mediators, and increase of mucociliary clearance. This product is available in 30 ml pump pocket spray and 50 ml or 100 ml continuous flow sprays with normal diffusion and are ready to use. Sinomarin plus algae allergy relief may be used for 30 days without interruption. For the 30 ml bottle, 1 to 2 sprays per nostril is administered for 6 to 12 years old and given up to 3 times daily, while children greater than 12 years old are given 2 to 4 sprays per nostril for up to 5 times a day. For the 50 ml or 100 ml bottle, 1 to 2 sprays per nostril is administered 2 to 3 times a day. Formulated for nasal use for the first time and covered by patent applications and/or granted patents, the new innovative line, Sinomarin plus algae with Algomer Complex, combines the natural decongestant action of hypertonic seawater enhanced with the sea algae extracts present in Algomer Complex that provide additional strength and protection to the nasal mucosa. Out of around 30,000 species of sea algae, 2 have stood out, attracting tremendous scientific attention over the last few years: Mundaria pinnatifida, and more specifically its fucoidan extract, and Spirulina platensis and its extracts. Based on numerous published scientific studies, these ingredients have demonstrated multiple biological activities that include soothing inflammation and activity against infectious. In this proof of concept study, a hypertonic seawater-based solution supplemented with extracts from the seaweeds Undaria pinnatifida and Spirulina platensis and dexpanthenol was found to be effective as an add-on treatment in symptom control of children with allergic rhinitis, suggesting that nasal irrigations may improve allergic rhinitis control with reduced use of medication. The medications commonly used for allergic rhinitis have shown by objective measures to be effective and safe, even for prolonged use. However, regarding children, parents and caregivers are often skeptical and unwilling to follow long-term treatments, which results in considerably low adherence. Nasal irrigations, particularly those with normal saline, have long been used to remove mucus from the upper respiratory tract, as they are safe, tolerable, and more easily acceptable by parents or caregivers. The effectiveness of nasal irrigations not only includes mechanical removal of mucinous excretions, but also an increase of mucociliary function, decreased interaction of allergens with the nasal mucosa, and reduced release of inflammatory mediators such as histamine, prostaglandins, and leukotrienes and/or receptors. Studies have shown their efficacy in allergic rhinitis and sinusitis, and meta-analyses support their use, with hypertonic solutions being apparently more effective than normal saline solutions. That ends my report, and thank you all for watching.